Hi team, welcome to the Codersguide. Today in this program, we would be having the CCS training program. So we do have a trainer. She's Namrata. She's gonna taking care of you the entire CCS training session, and she would be providing you the documentations, and she would be explaining you the all the concepts related to the CCS, PCS. So now we are having the lesser candidates here, but we would be providing this recording session to the candidates whoever would be joining for the CCS program. Okay. And let's start this session, Namrata.
Okay, Farzana. Yeah, good morning, everyone. This is Namrita. I'll just share my screen. Farzana, is my screen up?
Yes, Namrata, you can go ahead.
So today I'll be telling you regarding CCS, like what all will be included and what is actually into it. So CCS is a certification, like one of the certification that is required to enter into the field of medical coding. So CCS is nothing but it is certified coding specialist. So generally, most running certifications as of now in coding market is one is CCS and one is CPC. CPC is certified professional coder. Generally, people who want to acquire into this OP's coding, outpatient coding, will be going on to CPC, and CCS generally they'll be telling it for inpatient facility. But nowadays, even if you want to go to OP or IP, doesn't matter. OP stands for outpatient facility and IP stands for your inpatient facility. Doesn't matter, whatever it is, one certification is required. So CCS is like it will be having some higher standards when compared to your CPC certification. So CCS is generally it is headed by AHIMA. So AHIMA will be conducting this exam, CCS examination. Uh, and medical coding, if we talk what is medical coding, generally, technically, if we talk about this medical coding, we have to clearly review the medical document. Like in US, this is the pro forma they'll be following on to get uh, finances to the physician, like to get his revenue to the physician over there. Generally, this medical coding process will be used, wherein our job is to review the medical document that is provided to us. We have to clearly review whole the medical document, and then we will have some certain codes. So that codes will be in a language like they will be understanding, the insurance company people will be understanding that codes. Like every code will be having specific revenue dollar amount. So based on the dollar amount, they will be the amount will be charged on to the patient, and physician will be getting his revenue. So these codes generally we will be using four different books. So that four books are your first book will be ICD 10 CM, second book is ICD 10 PCS, third book is your CPT, and fourth book is your HCPCS level 2. So before going into these four books, generally it's a open book program. Like even when we are going to our exam, we will be carrying on our books. Like we have to just see like what is the actual disease condition patient is having, how is physician treating that disease condition, and what all things or what all procedures that have been performed on the patient. We will just see into this book, and then we have to assign the codes by using the medical document or medical record. So these four different books, the first book which I've told you, which is ICD-10-CM, deals up with all the diagnosis conditions. Diagnosis are nothing but disease conditions. For example, a patient is going to hospital today and is having some fever or something. Generally, if you take some fever condition, so fever patient is having fever and is going to hospital. Now physician will evaluate the patient, will examine the patient and tell which kind of fever it is, whether it's a viral fever or whether it's some kind of typhoid, dengue, or whatever it is. So upon final diagnosis, we will be coding that patient is having a disease condition, nothing but diagnosis, and that diagnosis code will be taken up from your ICD-10 CM book. Next is your ICD-10 PCS book. So ICD-10 PCS is specifically used in your CCS exam only, wherein this ICD-10 CM is used in your CPC as well as your CCS, but ICD-10 PCS is specifically for your inpatient facility, that is your CCS book. So in this, what we'll have is inpatient procedures. So inpatient is nothing but if patient is going to hospital and if his condition is somewhat on a critical thing. So in that case, physicians, they'll ask patient to get admitted into the hospital. So that admission into hospital is nothing but staying in the hospital is called as your inpatient facility. So what all procedures are performed in inpatient facilities, that particular procedures need some specificity. Like if I'm telling fever and then patient is getting admitted into the hospital. So fever alone, physician can't deal with that fever. He have to understand what is the actual fever that patient is having. Now, suppose if he's telling that patient is having typhoid, then for typhoid they have to give specific medication. Like that, what all specificity they have mentioned. So that specific codes will be there in your PCS book, and this is specific for your inpatient facility. So this is your second book that will be using in your CCS examination. Third book is your CPT. So CPT deals up with the procedures. It means in PCS is also used, CPT is also used in your inpatient facility. PCS is specific. PCS is very specific. CPT will tell us current procedure terminology. This also deals with your procedures, but it will not give deeper information when compared to your PCS. So this is also your procedure related. CPT is again used in your for CPC examination and CCS examination. We are now specifically talking about CCS, right? So if I want to tell you what all books that we'll use here in CCS, means your first book, that is your ICD-10 CM, deals up with your diagnosis. Second book is your ICD-10 PCS, deals with your specific inpatient procedures. And CPT, which is your current procedure terminology, deals up with general procedures that are performed in your inpatient facility. And in CCS, will not use this fourth book, which is your HCPCS. This is specific for your outpatient facility only. So you can exclude this book when we discuss about our CCS. So these are the only three books that will be used. And as I told you, CCS is generally offered by AHIMA and is used basically specifically for your inpatient facility. But nowadays, even for outpatient, they're accepting CCS certification. And it specifically focuses on advanced coding skills, because now like they are asking for specificity, like not in a general terminology. They are, whatever condition we are visiting, they will be examining it deeply, and then they will be treating the patient, right? So there are these advanced coding skills will be there, they have implemented in this CCS exam. I mean, a CCS theory part also will be there. In that theory part, you will have some advanced coding skills when compared to your CPC part. And exam overview, if we talk about, if you want to take up this examination, first you have to understand medical terminology. Reason why you have to understand medical terminology is, as we will be reviewing the whole medical document, they will be using some medical terminology that will not be in a general language. Like generally, I've told you fever just now. So generally, we will use the term fever, but in medical terminology, sometimes they will be mentioning it as pyrexia. So pyrexia is nothing but, again, it's a kind of fever. So medical term for your fever is pyrexia. So that terminology we have to understand. So when we are starting our session, I'll be providing you with some terminology parts also. So that terminology you have to understand. The only reason that you have to learn this terminology is you have to clearly understand the medical words. I mean, medical terms that will be mentioned in your document. Only if you understand that terms, you can review the medical record. Based on that, you can give your codes that are needed to code. And next, anatomy physiology. So general human anatomy physiology. So anatomy deals up with the structures of a human body, and physiology will tell the mechanism how is a human system is working. So that anatomy physiology, we have to have some knowledge. So this terminology part, anatomy and physiology, we will be providing with notes, and we'll give some glimpse of it prior to the CCS session. so that you'll be understanding what all will be there in it. And then comes, I've told you, ICD-10 CM, first book which deals with your diagnosis, PCS, your inpatient procedures, and CPT deals up with the procedures and coding scenarios. So what about this coding scenario is, like, they will be giving a scenario like, patient is having fever, he have come to the hospital today. Upon the examination, physician have evaluated the patient and is telling that patient have to undergo some minimal CBP or complete blood picture or related to some fever profile or something, to understand which kind of it specified fever it is. Now they'll be ordering some fever panel, and then upon testing, upon getting the results, physician have confirmed that patient is having typhoid. Now in this coding scenario, first patient have come with fever. Upon the examination, he have ordered some CBP, some fever profile, some CMP, like 3 to 4 labs they have ordered. And now you have to count on the labs, and then they have to see the results, and the result, upon the results, physician is confirming patient is having typhoid. And now physician will be asking patient to get admitted into the hospital. He'll be giving some IVs. He'll ask patient to stay in the hospital for around 2 to 3 days, take some treatments and everything, and then the patient will get discharged from the hospital. So now the entire scenario from the day one. On day one, he's having fever, which is on some higher temperature. He have ordered test. Typhoid is ruled out. And on the second day, he have started the treatment. And third day, the temperature is getting low and patient is getting recovered. And on the fourth day, patient is getting discharged. So now 4 days, you have to code CPTs. On the first day, CPT, like patient is having fever. This is how he have evaluated. Second day, he have given some injections. For injections, he have to code, and how he have dealt up with it, that you have to code. And third day, he have ordered some labs. For labs, you have to code. Everything you have to code, like day by day. So that is how a coding scenario will be there. So they'll be giving you scenario. You have to code ICD-10 CM on that, ICD-10 PCS on that, CPT on that, and then you have to submit your code. So that is how a coding scenario will be there. So no need to by heart anything from A to Z. No need to by heart anything. Everything will be there in your book. Only thing is, you have to understand how the codes will be there, how to read out the code, and then you have to assign it based on the medical record. That is it. And how will the coding workflow be? So coding workflow, first, as I told you, we have to review the medical record, and then first thing you have to look on is your diagnosis. Diagnosis, the cheat word for your diagnosis is disease condition. This is what is a disease patient is having. So I have told you fever, I have told you. Along with fever, patient might have some additional conditions also. It means fever, sometimes alone fever won't be there. Along with fever, cold will be there. Along with fever, maybe patient might have some diarrhea, some vomiting, or some kind of other conditions. So now you have to understand what is the principal diagnosis and what is a secondary diagnosis upon all of this multiple diagnosis. It means patient is having 5 multiple conditions. So among these 5 multiple conditions, which is the primary diagnosis? It means what is the main reason that patient have come today to the hospital. So now today patient is coming to the hospital and reason is fever. So fever has to go on the first line. So which condition we are coding on the first line? That condition is called as principal diagnosis. Other name for your principal diagnosis is your primary diagnosis. Next, second diagnosis. 5 I'm having. First I have coded that, I'm calling it as principal. Second diagnosis on the second line which I'm coding, that is called as secondary diagnosis. And third, no need to count on third, fourth, doesn't matter however we code it. So first you have to give importance to your primary diagnosis, secondary diagnosis. Reason is, primary diagnosis will have more dollar amount when compared to the next preceding diagnosis codes. So that's the reason, always prioritize your primary diagnosis. That is very, very, very important. Like after coding, we'll be sending our coding to auditing team. They'll be auditing. What auditors will be doing is, they will be auditing. They'll be telling whether whatever we have done is appropriate or no. So there also you will be having like audit percentage will be given at the end of the day every day for you. So there also there'll be giving you errors if you're not giving proper primary diagnosis. So primary diagnosis have like more value when compared to other diagnosis. So always focus on your primary diagnosis, secondary diagnosis. That is very, very important. So once you're done with your diagnosis, then you are ICD-10 PCS, it means your inpatient procedure code, then your CPT if it is required, and then you have to clearly evaluate at the end before submitting your chart. You have to clearly look on to this whether you have clearly reviewed your medical record, clearly given all of your diagnosis, your CPT, ICD, everything, and then you have to submit your chart. So this is for every particular chart I'm telling. Sometimes you might have like 40, 50, 60, 100 also, like based on the your how much severity charts you're getting. Based on that, you will be having your count in whatever project you're working. And sample case. So this is a general sample case. He's telling that patient diagnosis. It means disease condition. What patient here is having is appendicitis. So appendicitis is nothing but appendix is a part of your large intestine. Itis is nothing but inflammation. Inflammation is swelling. So patient's today's diagnosis is nothing but patient is having acute appendicitis. It means inflammation in appendix. And upon this disease condition, physician have evaluated the patient and is telling that patient have to undergo a procedure called as laparoscopic appendectomy. Laparoscopy is nothing but it's a instrumental procedure. It means generally you'll have two types of procedures: open procedure and laparoscopic procedure. Open procedure is nothing but they will be making a like somewhat big cut onto your body, and then manually they'll be removing out whatever they want to remove from your body. It means appendectomy is nothing but removal, surgical removal of your body part or whatever it is. So here patient is undergoing appendix removal procedure. So appendix removal procedure, generally as I told you, any surgical procedures will be of two types. One is open procedure wherein manually they'll be removing out the body part. Second type is laparoscopic. It means they'll not manually open it, they'll be making some two small uh, openings onto the body, and then they'll be using some instrument called as laparoscopic machine. By using that laparoscopic machine, they'll be removing out whatever procedure they want to do. So here the suitable procedure for patient here is laparoscopic appendectomy, and physician have done this procedure. Based on that, you have to give your ICD-10-CM, which is your diagnosis. In your book, ICD-10-CM book, you will be having laparoscopic appendicitis related condition, which is case series code, and then you have to give your ICD-10 PCS code and CPT code also. So this is how you will be coding your sample cases. So in all the procedures, every chart you will be coding like this only. And as I told you, principal versus secondary diagnosis. So if multiple diagnoses are there, you have to prioritize your principal diagnosis. Principal diagnosis generally, how can you choose a principal diagnosis from multiple diagnoses? So principal diagnosis, always you have to take like what is the reason that patient is visiting to the hospital. Patient is visiting for fever, so fever will be your primary diagnosis. Or patient is visiting for appendicitis, appendicitis will be your diagnosis. Now, patient is having fever. He got admitted into the hospital. Physician have ordered some tests. And you have finalized patient is having typhoid. Now, fever, you'll not code fever. Like general fever unspecified also, you'll be having one code. When we start into ICD-10-CM, you'll be understanding that. So now, fever. In fever, I'm having a specific fever, which is typhoid. Now, no need to code fever, which is unspecified. I have to code my specific thing, which is my typhoid. It means upon ordering the labs, patient have undergone some laboratory tests, and physician have ruled out that patient is having a specific disease, that is typhoid disease. So typhoid will be a principal diagnosis now. And along with typhoid, what patient is having is some having vomitings, is having diarrhea, and all of that will be going on to your additional diagnosis code. So it means second place, third place, fourth place, however it might be, like how many it might be, you have to code it like that. And ICD-10 PCS. So ICD-10 PCS full form is International Classification of Diseases 10th version procedure coding system. So specifically the term here you have to understand is procedure coding system, PCS. So code length will be having, it means generally I have told you codes, right? So you'll be having standard characters. It means to code your, to make up your PCS code, you will be having 7 characters. You cannot code more than 7 characters. You cannot code less than 7 characters. Fixed characters, 7 characters you'll be having. So 7 characters, the first character will tell us into which section the patient is going to, like whether it's a surgical section or whether the patient is going for some kind of radiology. Radiology is nothing but kind of testings like CT scans, MRI scans, or some kind of laboratories, or if patient is going for some injection administrations or IVs, like that. That which section is patient is going into, that will tell us your first character. Second character will tell us about body system, into which body system it is. We'll be having multiple body systems in our body, like digestive system, cardiac system, musculoskeletal system, gynec system. So all of this, into which system, that system will be briefed up in your second character, which is your body system. Third thing is root operation. What is the actual thing that patient is undergoing? Now, we have seen acute appendicitis. So appendicitis is a general thing. Like patient is having some medical condition. So patient is having that acute appendicitis. And which body system? As I told you, appendix will be there in your intestine will be coming under your which body system? That's your digestive. So body system will be your digestive. For this, you will be having some representative character for digestive system. That character you have to give. So everything will be there in your book. No need to mug up anything over here. Just for understanding purpose, I'm telling you. Third thing will be your operation. It means what is the actual procedure patient is undergoing. He's undergoing appendectomy. Ectomy means, as I've told you, removal of something from your body. So he's undergoing a removal procedure. So your root operation will be removed. Body part, I have told you body system. Which system? It is digestive. Now in digestive system, I have my stomach, I have my mouth, I have my intestine, anus, rectum, large intestine, small intestine, everything. So in this particular system, at which particular part patient is undergoing this surgery? It means a particular body part, and that body part is my appendix. So your fourth character will tell you on which body part it is. And fifth one will be approach. Through which approach? Now I have told you laparoscopy and open, right? So whether patient is undergoing it in a open manual procedure, or the patient is undergoing the procedure through a laparoscopy mode. So which approach the patient is undergoing? So that deals up with your fifth character. And sixth character is device and qualifier. These are your additional terms. So you'll be having some additional things in your book. So based on that, you can select your device and qualifier. So this is how whole upon taking up of all these 7 characters, that will give you a PCS code, which will clearly give information on what procedure patient is undergoing. Like this section, this body system, this particular operation, this particular body part, approach, device, and qualifier. Whole thing will make up a clear PCS code. And these are the common root operations. So upon calculating all of your 7 characters, root operation is your main term. Like this will clearly tell you, like I've told you body system, everything, but what is the actual procedure patient is undergoing, that will be ruled out in your root operation. That's the reason in all of the 7 characters, your third characters plays a very major role, and these are some of the commonly used root operations, like excisions, resections, drainage, bypass, replacement, insertion, repair, fusion. So we'll be having detailed notes regarding all of this. Like excision is a complete removal of something, resection is partial removal, drainage, so something some patient is having some pus that got accumulated on patient's body, or patient is having some cyst in her ovaries, and now that cyst has to get removed. So cyst will generally have some accumulation of some fluid or pus or water, something, whatever it might be. So that has to be removed from the body. It means they are draining out some fluid from our body. That operation is called as drainage. Bypass. So bypass generally routing, making a clear new route for your blood flow through the arteries or through the veins. So that is your bypass. Replacement. They are removing something and replacing it. Like patient is undergoing some total knee replacement, so they are removing the patient's knee and replacing a new knee over there, some artificial knee. So this is called your replacement. Insertion of something. Insertion is different, replacement, yeah, these are your general terms, but I'll tell you what all will be there over here. Repairing something got failed or damaged, they have to repair it. Fusion, something got uh, uh, departed, and you have to fuse those things. Like generally vertebral column, you'll be having these fusion procedures. So these are your common root operations. We'll have multiple examples on this. Once I start your uh, session, I'll be telling you. And coming on to your career opportunities over here, so you will be having opportunities to work in hospitals. So most probably, upon all of this, we will have career into, like, most of the MNCs are hiring for this medical coding job opportunities, and you're having many of the coding companies have arose now. So you'll be having career opportunities, and comparatively, if you're working in an inpatient facility rather than outpatient, you will have more growth opportunities internally, if we talk about. And talking about training part, once I complete ICD 10 CM, every day I'll be giving you some kind of assessments, like to test what all you have understood, and weekly assessments will be provided. Once we are done with all of those, I'll be providing you with previous papers, so you can practice that, so that will be helpful for you. So for all of the coding scenarios, your ICD 10 CM, ICD 10 PCS, so everything will be there. Mock test will be given to you, so you can practice that. Once you are done with each paper, we'll be having a revision session on the next day of our class. So that is it from my end. If you're having any doubts, you can ask me. Any questions?
Team, if anyone having any concerns, any queries related to the CCS, you could ask a trainer now. Please respond. This is an interaction session. You could respond.
No doubts, ma'am.
Okay. We just wanted to know, whoever joined here, all of those are the experienced candidates, isn't it? Santhya, Meenakshi, Manoj, Vanilla, Sayed. Please respond.
Yeah, yes, sure, but I have a HSC board only experience.
Sorry, your voice is too low.
Yeah, yes, I have a HSC coding experience only.
Okay. How many years of experience do you have?
6 years of HSC.
Sorry, three,
6.
6 years. Okay, fine. Thank you. Others?
Hi, this is Manoj. I
Yeah,
have
hi,
6 years
Manoj.
experience in ED facility and
8 years.
yes, 6 years,
Okay.
6 years in ED.
6 years into?
ED, emergency department.
Okay.
OP.
Okay, Manoj. Thank
Thank
you.
you. Thank you.
Hi, I'm Sayed. I'm calling from I'm joined from Tamil Nadu, Madurai. Actually, I'm working in health insurance claims.
Okay.
So actually, I plan to do the medical coding. So what is the difference where we are working in hospital and medical coding facilities?
Okay.
So
Over
in
to you,
claims also
Navneeta.
we are same doing that same the documentation procedures. So this we are doing only electronically, right? Or the difference?
See, from our end, our job is to generate revenue to the provider. Their thing, they'll be just evaluating it. We have to clearly give on the codes over here. So our job is to assign the codes and then submit it to the companies, insurance companies, so that physicians will get their revenue.
Okay.
Yeah, yes, Narmad, I have a doubt.
Yes.
Yeah, in this medical coding HEC, I mean, 6 years of experience.
Mm.
Hereafter, I will move in pressure for the IPDRG. Can I able to understanding the pressure or any experience related something?
You can like see if you want to move on to IPDRG. IPDRG is a vast subject actually. So even if you want to go over there, this is the thing that we'll be using PCS, which I've told you till now. Also in even IPDRG, you'll be using PCS only, but you'll be having some additional points comparatively. So you can take this experience. You can tell them that you're having experience into HCC and just have an experience of around 1 year into IPDRG.
Okay,
So
okay,
that
okay,
would be
Narmada.
excellent.
Thank you.
Yeah.
Sayed, is your concern got clear?
Sorry, I'm not getting.
Yeah, whatever the query you have asked, is it clear
Yeah,
for you
yeah,
now? Okay.
yeah, yes, clear.
So are you
Yeah,
fresher, Sayed?
yeah, I'm fresher actually. I'm working in claims in health insurance. So I'm
Okay.
plan to do the medical coding.
So you do not have any exposure into coding, right? Guidelines,
No, no,
code
I don't
leading.
have.
Okay.
No.
Okay, Sayed. Thank you.
Okay, thank you.
Santia, Vanilla. Sheelampalli. Team, this is just an interactive session. If you do not come up with your queries and if you do not speak up, it would be difficult moving forward. The more you interact, you would be having a lesser doubts related to it, and you would be giving the exam with confidently.
Hi, ma'am. There is no doubts. It's clear.
Okay, Raju. And how many years of experience do you have?
I have 2 years experience in IBM,
IPTRG. Okay, fine.
but I have CPC, so that's why I will shift
Yeah,
to CCS.
CCS is mandatory. Yes.
Yes.
Okay, Raju. Thank you. Sheelampalli, Vanilla, and Santya, are three of you are experienced or the freshers?
I mean, Sandhya, I
Hi,
have 4 years experience in HCC coding.
into HCC, Santya.
Uh,
Okay,
3 years.
okay, thank you.
Yeah, hi. Actually, I had completed my graduation in Hyderabad. So I was planning for medical coding. My brother-in-law had told me that just join this, you get to know what is what. So I'm a fresher.
Okay, okay, Sheelampalli. You and
Okay.
Sayed are the freshers. We would help you out. Okay,
Yeah, okay. Thank you.
thank you. Vanilla, are you experienced with a fresher?
Hi,
Okay,
ma'am. This is Vanilla. I
yeah,
have 4.5 years experience in HCC coding.
okay, thank you so much. Okay, team, we'll let you know the timings and the duration. Namrata, have you told the duration of this course?
Yes, yes. Sorry, I forgot it. So duration, as you guys are experienced, so it will be around 25 days because some of you are from HCC, right? So you have to understand PCS. That's the major part in CCS. So it will take around 25 days.
Okay, okay, Namrata, thank you.
Yeah. And you'll have classes from Monday to Friday, and Farzana will be finalizing the timing. So Saturday and Sunday will be off. So Saturday, Sunday, I'll be providing some practice papers to you so that what all we have done on the week, you can revise all of this. Yeah, Farzana.
Okay, thank you, Namrata.
Yeah, thank you everyone.
Thank you. Thank you.
Thank you all.